Hello everyone. The topic for this session is palate and palatine tonsil. The objectives are to learn about hard palate, its formation, blood supply, nerve supply, the soft palate, its formation, muscles forming it, the blood supply, nerve supply and the lymphatic drainage, the functions, the development of the palate and the clinical aspects. Also, we will learn about palatine tonsil, its situation, the gross features, blood supply, nerve supply, lymphatic drainage, the development and the clinical aspects. So, the palate, it is a structure which intervenes between the roof of the mouth and the oropharynx and the floor of the nasal cavity and the nasopharynx. So, it is the structure between the oral cavity and the nasal cavity. It includes hard palate and the soft palate. The hard palate, as we have seen in the base of the skull, it is formed by the palatine process of maxilla, the horizontal plate of palatine bone. So, these two pairs of bones are joined by the cruciform suture, that includes intermaxillary suture, the interpalatine suture and the palatomaxillary suture. In adults, it lies at the level of axis vertebra, but in infants, it lies between the skull and the atlas vertebra. Anterolateral margins of the palate are continuous with the alveolar arches and the gums. The posterior margin gives attachment to the soft palate. The superior surface forms the floor of the nose and the inferior surface forms the roof of the oral cavity. So, when we observe the superior surface, that is towards the nasal side, is lined by mucous membrane and the ciliated columnar epithelium. The oral surface is lined by the stratified squamous epithelium. So, in the inferior surface, we can see the incisive papilla, the irregular transverse ridges or the rugae which looks like a folds, the palatine RAPHE, a thin sheet, and the minor salivary glands of mucus type. The blood supply is by the greater palatine artery. The venous drainage is by pterygoid plexus of veins. The lymphatic drainage is by the retropharyngeal nodes and the deep cervical lymph nodes. The sensory nerve supply is by greater palatine nerve, the nasopalatine branches of the maxillary nerve. The secretomotor fibers from the pterygopalatine ganglion runs with the nerve to supply the palatine mucous glands. So, now we will discuss about the soft palate. It is a mucus covered fibromuscular glandular mobile flap which is suspended from the posterior border of the hard palate. It slopes downwards and backwards between the oral and the nasal part of the pharynx. It is having two surfaces. The anterior surface, it is concave and is marked by a median raphe. The posterior surface is convex and is continuous superiorly with the floor of the nasal cavity. It is having four borders. The upper border or the superior border, it is attached to the posterior border of the hard palate, blending on each side with the pharynx. The lower or the inferior border is free and bounds the pharyngeal isthmus. So, from its middle there hangs a conical projection called the uvula, and it is having two lateral surfaces, two lateral borders. It includes two arches. One is palatoglossal arch that is also known as the anterior pillar or the fossus. It contains the palatoglossus muscle and reaches the side of the tongue at the junction of its oral and pharyngeal parts. So, this fold forms the lateral boundary of the oropharyngeal isthmus or the isthmus of fossus. Another arch is the palatopharyngeal arch, also that is the posterior fold or the posterior pillar of the fossus. It contains the palatopharyngeus muscle and it forms the boundary of the tonsillar fossa. So, in this diagram we can see the palatoglossal arch and the palatopharyngeal arch. So, between these two arches there is a tonsillar fossa where the palatine tonsil is placed. The pterygomandibular raphe, it is a tendinous band between the buccinator and the superior constrictor muscle. It is an important landmark for the posterior alveolar nerve block. The composition of the soft palate, it includes palatine aponeurosis, the 5 pairs of palatine muscle, the nerves and the vessels, the palatine gland and sometimes upper end of the palatine tonsil. The arrangement of the structures of the soft palate, it consists of the mucous membrane of nasopharyngeal surface, a layer of palatine glands, anterior fasciculus of palatopharyngeus and levator veli palatini, the palatine aponeurosis which splits in the middle to enclose the musculus uvulae, the palatoglossus muscle, a layer of palatine glands, the mucous membrane of the buccal surface. So, we are seeing the arrangements from the nasal cavity towards the oral cavity. The mucous membrane, it is lined by non-keratinized stratified squamous epithelium except the upper part of the posterior surface which is lined by ciliated columnar epithelium. The palatine aponeurosis, it is a fibrous framework of soft palate where all the palatal muscles are attached. So, it is the expanded tendon of insertion of tensor veli palatini. So, here we can see the green colored structure. So, that is representing the palatine aponeurosis. So, the muscles of the soft palate, it includes 5 pairs of muscles, that is levator veli palatini, the tensor veli palatini, the musculus uvulae, the palatopharyngeus and the palatoglossus. So, in another view we can observe these muscles, that is tensor veli palatini, levator veli palatini, musculus uvulae, palatopharyngeus and palatoglossus. So, this is another view where we can observe the base of the skull also. So, here we can observe the pterygoid hamulus, the pterygoid plates, the petrous part of the temporal bone and also the posterior border of the hard palate. So, all these structures gives origin to these muscles of the soft palate. So, levator veli palatini, it arises from the apex of the petrous temporal bone, the carotid sheath and the medial lamina of cartilaginous part of the auditory tube. The insertion, the upper surface of the palatine aponeurosis and it elevates the soft palate. Tensor veli palatini, it arises from the scaphoid fossa, so which is present on the posterior aspect of the medial pterygoid, the fibrous lamina of the auditory tube and the sulcus tubae and the spine of the sphenoid. And it is inserted forming the palatine aponeurosis. It stretches and depresses the soft palate and dilate the auditory tube. Next is the musculus uvulae. It arises from the posterior nasal spine, the palatine aponeurosis, inserted into the submucous tissue of the base of the uvula. It pulls the uvula forward to its own side. Next muscle is palatoglossus. So, it arises from the palatine aponeurosis and inserted into the side of the tongue. It elevates the base of the tongue. Palatopharyngeus, it arises from two fasciculus. The anterior fasciculus arises from the posterior border of hard palate and the upper part of palatine aponeurosis. The posterior fasciculus, it arises from the lower part of palatine aponeurosis. So, here we can see the anterior and the posterior lamina of the palatopharyngeus. It is inserted into the lamina of the thyroid cartilage, and the pharyngeal raphe form the palatopharyngeal sphincter. It elevates the larynx and the pharynx. So, when you observe the soft palate, it is nothing but a meeting place of three U-shaped slings of muscles. One is the sling of the levator palatini, another is the sling of palatopharyngeus in the Passavan's ridge, another is the sling of palatoglossus around the oropharyngeal isthmus. Nerve supply, the motor nerve supply, all the muscles is supplied by the cranial part of accessory nerve through pharyngeal plexus except the tensor veli palatini. So, tensor veli palatini is supplied by the mandibular nerve trunk. The sensory or the general nerve supply is through the greater and the lesser palatine nerve, the spinopalatine nerve and the glossopharyngeal nerve. The secretomotor nerves are contained in the lesser palatine nerves. They are derived from the superior salivatory nucleus and travel through the greater petrosal nerve. And in the special sensory or the gustatory nerves, the taste fibers that carries the taste sensations from the palatine nerves, it enters the pterygopalatine ganglion. From the ganglion, it passes to the nerve of pterygoid canal and it passes through the greater petrosal nerve and finally reaches the facial ganglion or the geniculate ganglion of the facial nerve, and from there to the nucleus of tractus solitarius. The blood supply, the arterial supply is by greater palatine artery branch from the maxillary artery, the ascending palatine, the branch of the facial artery, the palatine, the branch of the ascending pharyngeal artery. The venous drainage is through the pharyngeal venous plexus through the paratonsillar vein. The lymphatic drainage is to the upper deep cervical nodes and the retropharyngeal lymph nodes. The Passavan's ridge. The upper fibers of the palatopharyngeus passes circularly deep to the mucous membrane of the pharynx. It forms the sphincter internal to the superior constrictor and forms the Passavan's muscle. So, on contraction, it raises a ridge, that is the Passavan's ridge. So, when the soft palate is elevated, it comes in contact with this ridge, the two together closing the pharyngeal isthmus between the nasopharynx and the oropharynx. So, that is how the soft palate acts as a traffic police. When the food is entering to the oral cavity, it closes the nasal cavity. Functions of the soft palate: it acts as a flap wall and helps in blowing, coughing and sneezing. When the soft palate is pulled inferiorly, it cuts off the mouth from the pharynx. Thus, it permits the respiration to continue during sucking or chewing without danger of inhalation of the food or the fluid. The uvula prevents the soft palate being forced into nasopharynx or mouth. When tensed, the soft palate assists the tongue in directing the food and the fluid. By varying the degree of closure of the pharyngeal isthmus, the quality of the voice can be modified. So, now the development of the palate. It consists of the two parts developmentally. One is the primitive palate, another one is the permanent palate. The primitive palate is a wedge-shaped area in front of the incisive fossa and carries the 4 incisor teeth. It is formed by the fusion of the maxillary process and the globular part of medial nasal process and continues above with the median nasal process. The permanent palate, during 6th week, a shelf-like projection, the palatine process grows medially from the inner surface of each maxillary process. During 7th week, the mandibular arches grows more ventrally and caudally, producing the prominence of the chin. And ventrally, the permanent palate meets with the primitive palate in a Y-shaped manner. So, the permanent palate is formed as the ventral 3/4 of the permanent palate is formed by fusion of the palatine processes with each other, and the caudal edge of the nasal septum forms the hard palate. The dorsal 1/4 of the permanent palate forms the fusion of the palatine process which failed to fuse with nasal septum and hangs as a curtain, that forms the soft palate. So, the overall development of the palate in this pictorial we can see. So, the congenital anomalies. The cleft palate, whenever there is the fusion is not happen either between the two palatine process or between the nasal and the palatine process, that will lead to the cleft palate. So, this cleft palate may give rise to the dental problems, the aesthetic problems, hearing and speech problems, psychological problems. The inflammatory papillary hyperplasia, the common lesions seen on the central hard palate in response to the chronic denture irritation. So, now we will discuss about the palatine tonsil. So, palatine tonsil is an aggregation of the lymphoid tissue and it is a part of the Walde's ring. So, the Walde's ring is represented as a ring, that is a group of the lymphoid tissue around the oral cavity, that includes the lingual tonsil, the palatine tonsil which is more important, the tubal tonsils and the adenoids. The palatine tonsil, it is an almond shaped mass of lymphoid tissue situated in the palatine fossa or the tonsillar fossa. The boundaries of this fossa, anteriorly it is bounded by palatoglossal arch, posteriorly by the palatopharyngeal arch, and superiorly the meeting point of these two arches, inferiorly the dorsal surface of the posterior 1/3 of the tongue. The laterally it is related to the lateral wall of the oropharynx. The presenting parts, it is having two surfaces, medial and lateral. The two borders, anterior border and the posterior border, and two ends, the upper and the lower end. The medial surface, it bulges into the oropharynx. It is lined by non-keratinized stratified squamous epithelium, and it shows the tonsillar pits The intertonsillar cleft. So, this represents the development of the palatine tonsil. So, the larger cleft is known as the intertonsillar cleft. So, that is nothing but the clefts or nothing but the embryonic folds. The lateral surface, it is attached below to the side of the tongue. Structures related to this surface forms the tonsillar bed. So, what are the structures present in the tonsillar bed? From medial to lateral side, it includes fibrous capsule made by condensation of pharyngobasilar fascia, the loose areolar tissue containing peritonsillar vein, the superior constrictor muscle, the loop of facial artery and its tonsillar branch, the ascending pharyngeal artery, and the styloglossus and stylopharyngeus muscle. It is having anterior border that lies deep to the palatoglossal arch and the posterior border that lies deep to the palatopharyngeal arch. It is having two ends. The upper end is encroached on the soft palate and the lower is continuous with the lingual tonsil connected to the side of the tongue by suspensory ligament of tonsil. Blood supply. The arterial supply is by tonsillar branch of the facial artery, the dorsal lingual branch of lingual artery, the ascending palatine branch of facial artery, the descending palatine branch of ascending pharyngeal artery and the branch from greater palatine artery. The venous drainage is through pharyngeal venous plexus through the paratonsillar vein and the lingual and pharyngeal veins. The internal jugular vein. The lymphatics, it drains into the jugulo-digastric lymph node. So, it is also known as the tonsillar nodes. During the inflammation, these lymph nodes will enlarge. The nerve supply is by glossopharyngeal nerve, the greater palatine nerves and the lesser palatine nerve. It develops from the ventral part of the second pharyngeal pouch. Functions of the tonsil. It has a protective function in that it prevents entry of the pathogens through the nasal and the oral route. The crypts on the surface of the tonsil serve to increase the surface area and increase the efficiency of protection against pathogens. It forms a part of Walde's lymphatic ring. Applied aspects, tonsillitis and tonsillectomy. So, in tonsillitis various types are there. It may be a bacterial, viral, or it may be acute tonsillitis or chronic tonsillitis. Some of the examples we will see. The catral tonsillitis occur as a part of generalized pharyngitis, usually seen in the viral infections. The follicular tonsillitis, here the infection spreads into the crypts and the purulent material presents at the opening of the crypts as a yellow spot. So, in this picture we can make out that yellow spots. Membranous tonsillitis, it occurs due to pyogenic organisms. An exudative membrane forms over the medial surface of the tonsils. It is a feature of the acute tonsillitis. Quinsy. Quinsy, it is a peritonsillar abscess, that is there will be a collection of pus in the peritonsillar space. The features are they will be having dysphagia, fever, muffled and thick speech, that is hot potato voice, and the swollen soft palate. The uvula is swollen and edematous. So, tonsillectomy. So, during the inflammation, the removal or the surgical removal of the tonsil is known as the tonsillectomy. Here during this procedure severe hemorrhage may occur from paratonsillar vein or the tonsillar branch of facial artery. The glossopharyngeal nerve may be injured causing loss of taste sensation from posterior 1/3 of the tongue. So, now the questions for the assignment. The described muscles, nerve supply, development of soft palate. Name the muscles of soft palate. Give origin, insertion, nerve supply of levator veli palatini muscle. The muscles of soft palate, attachment, nerve supply and action. Structures forming Walde's ring. Name different types of tonsil. Describe palatine tonsil under following headings: position, blood supply, relations, development and applied anatomy. The blood supply and lymphatic drainage of palatine tonsil. Thank you.